Hello, it's Dr. Rhonda Johnson. It's Friday, September 22nd, 2023, and today I'm talking about Paxlovid and Lagevrio. These are two antiviral drugs that were approved by the FDA in the treatment of Covid-19. While there's a new study that was published online in the Journal of the American Medical Association Open Network on September 22nd, and this was a cohort study of people who received a diagnosis of COVID-19 at Cleveland Clinic between the dates of April 1st, 2022 to February 20th, 2023. Now, this is the period that the Omicron variant evolved from BA.2 to BA.4 and 5, then to the BQs, and then finally to the XBBs, and who were at high risk of progressing to severe disease. So the researchers found basically that these drugs are still highly effective, but that Paxlovid is less effective now with these newer Omicron subvariants and preventing hospitalization and death. So the numbers are like this. Paxlovid was 37% effective at preventing death or hospitalization in high-risk patients compared to no treatment. And Lagevrio, which is made by Merck, otherwise known as molnupiravir, was about 41% effective. Now, remember when these drugs were initially authorized under the emergency use program, the Delta variants were predominating. So concluding, the authors state their study found that use of either Paxlovid or Lagevrio was associated with reductions of mortality and hospitalizations in patients infected with Omicron, regardless of their age, race, ethnicity, virus strain, vaccination status, previous infection status, or coexisting conditions. So that's good news. And they said that both drugs, therefore, can be used to treat non-hospitalized patients who are at high risk of progressing to severe COVID-19. Now recall that Paxlovid can be given to people 18 years and older who weigh at least 80 pounds, and Lagevrio has been authorized under the emergency use authorization program for adults 18 years and older. You have to have a diagnosis of mild to moderate COVID-19 who are at high risk for progressing. Now, both of these drugs are available by prescription only. Your prescriber needs to review them against your current medications that you may be taking to make sure there is no interaction. And Lagevrio is not recommended for people who are pregnant or breastfeeding. So that's my information today. One more thing to remember, because we are in a current increase in COVID infections. So if you're eligible for these drugs, please talk to your doctor and review your risk and see if you are at risk for mild to severe progression of COVID-19. Take care, folks, and be safe and be well.